interns, we're back. If this is your first time watching one of my videos, my name is Daniela and I am an incoming dermatology resident. My first video, intern year in the COVID era part 1, talks about expectations and the typical day for interns. In this video, we're going to chat more about specific tips and specifically for working with COVID-19 positive patients. Let's get started. Now some tips. So the first tip is have low expectations for yourself. Don't go in thinking that you have to be the best doctor who knows everything on that very first day, the very first week, the very first month. No, you have to take time to figure out the hospital and what you're doing and getting used to writing a whole bunch of notes while taking phone calls. Let yourself take the time to get adapted to your new situation. If your senior's right there and they tell you to do something and you don't know how to do it, don't beat yourself about it, just ask them. And that's actually my second tip. Don't be scared to ask for help, because this can, not only does it just waste time if you're just scared to ask for help, it can also lead to mistakes as well. So don't be scared to ask for help. Everyone knows that you're an intern. Nobody expects you to know everything. So yeah, just ask for help. The third tip is it is normal to feel tired, to feel overwhelmed, and to feel inadequate. It is so normal. I think a lot of times it's very isolating as an intern when you feel that way and you don't think anyone else is feeling that way. Trust me, everyone is feeling that way. Even your seniors are feeling that way. Okay, don't stress about it. You are just starting off as a doctor. How could it not be tiring? How could it not be overwhelming? How could you not feel inadequate? You went to med school. You already have such high expectations for yourself. So you will have those times where you're like, oh, I just feel inadequate. I made this mistake. I did this wrong. I didn't know this and I should have. It's okay. You'll have those feelings. Accept it and move on, because you're here to learn. That's what it is. You're here to learn. So it's okay. Your next tip is tip number 4. Be friends with everyone. And when I mean everyone, I don't mean your co-residents, I don't mean your attending, I mean everyone, like the unit secretaries, the respiratory techs, the environmental services. All of those people are part of the healthcare environment, and not only does this help form a great relationship with the people that are helping in the care of your patients, but also it helps create an environment of a feeling like home, and it also is very helpful. Every single person plays such an important role in the hospital that they can help you out. We're all in this together when it comes to patient care. Well, the nurses, we all know, have a wealth of information and they can help you out so much. A lot of them have been in the hospital for a really long time, have worked with residents and especially interns for a very long time. So they definitely can help you know your way around the hospital, know where supplies, equipment are. They can show you how to do things like drawing blood. They are a great resource. And of course, the nurses are going to know your patient the best because they are around your patient almost all day long. So you definitely can always reach out to the nurses to find out updates on your patient. Then there are the respiratory therapists. They are also a great wealth of information. They deal with all of the needs of oxygen. So BiPAP, CPAP, high flow nasal cannula, and ventilators. It's what they focus on, and any questions that you have on ventilators or CPAP, BiPAP, or any of those, respiratory therapists are always willing to help. If you want to get help on learning how to get ABGs, you can also ask a respiratory therapist to help you. So next up are the unit secretaries. So they are also a great wealth of information. They usually know about incoming admissions, like a patient that's coming up to the floor, who's pending for discharges. They can help you get phone numbers. So if you need a phone number for, let's say, a radiology consult or something like that, they're very helpful in that regards as well. So that's how they can help you out. And then there are the pharmacists, and the pharmacists are also very helpful, and I'm sure you know how they can help you. They'll definitely help you with medication management. But I just want you to remember that there's so many resources in the hospital and that you're not alone, and making friends with everyone will remind you that you're not alone, and you will know how to navigate the hospital a lot better. There are also many other hospital employees that can help you day to day, but I just wanted to throw a few out there. This video is really long and I want to keep you guys' attention so we can get through it all. So we're just gonna keep going, okay? Dealing with a difficult attending or a difficult senior. So first, let's just say that you can't get along with everyone. That's just the reality of it. Everybody's personality is different. I think like in med school, or actually residency interviews, they will ask you like, how do you deal with like a difficult person or a difficult situation or something like that. So everyone works differently too. So you should be able to adapt to the way that people work differently. I don't think that you really should sweat things or get too bothered by things unless you think someone is like completely disrespectful, or if it's affecting patient safety. And at that moment, you should either give feedback to the person directly, or you should take it up to like your program director. And I had a situation myself where I had a bad experience, but it reached a level of like disrespect, and I did take it up to my program director because I was like, I didn't feel like it was inappropriate, and I don't think that, you know, someone else should go through a situation like this. And at the end of the day, not everyone is going to work the way you would like them to, but there's always a boundary to everything. So just being open-minded that everyone's going to be different, and once patient safety is not in the way and not like blatant disrespect to you, then I think just being open-minded is just really important. We're all part of a team, and we just have to accept all the different personalities that come with the team. The next tip is interacting with med students. This one is funny because I know you guys are just now starting as interns, so you're like, I was just a med student. So it's really crazy when you start working with med students, because not until I started working with med students, I was like, oh wow, med students can be useful. Because as a med student, I felt so useless. And when my residents were like, oh, you're so helpful, I thought they were just being nice. But no, med students could be helpful. When they're not doing what they're supposed to do, they're actually very unhelpful and can slow you down. What I would say is that when you're working with a med student, definitely give them your expectations and like how they can help you best, because then they can really slow you down. When it comes to teaching med students, a lot of times it's left up to the senior. I don't know how your program will be like, but if you also have to teach the med students, one of the tips, especially when you're first starting, I would say is give them a topic to learn and to teach back to you, and then you'll be like, oh, I'm remembering some of this now, and it helps you too as well. So you can definitely do that. But a lot of the times the seniors will be teaching the med students because they know you're like super swamped doing your own stuff. Additionally, give your med students feedback, because like I said, you want them to actually be helpful. You don't want them to be slowing you down, not being helpful, and just like being there, and also just like not learning, because you have to remember that you were a med student as well, and you wanted to learn when you were on the floors. So make sure you're figuring out ways to keep them in the loop and keep them also being able to help you. The number one way that med students definitely do help, especially when you start, you're so flustered before you present, because you're still trying to get everything together, and just like seeing 7 to 10 patients a day and gathering everything right before rounds is like feels so overwhelming when you first start. So when you have med students who present, you're like, oh, I have a little bit of time to like go through some data as they're talking. So they do help you out. Lastly, ask them to give you feedback so you can improve as well and know what you should be doing to help them. The next tip is tip number 8, which is prioritizing your day off. So depending on what program you are in, most interns are going to have to work 6 days a week, with some golden weekends scattered throughout, but you only have one day to get your life in order. I would suggest prioritizing what you need to do on your day off. So for example, sometimes it will be chores, right? Like washing clothes, cleaning the house, washing your hair, groceries. Literally all that pretty much takes up your whole day in general. So sometimes what I would do was certain things that I know would have to be done, like washing clothes, I'll try to do it on a nighttime after work so that I don't have to do it on the weekend. Sometimes you just have to like do a give or take. Say like I might have to, not mop this weekend because I want to rest. Because a lot of days off, you are going to be so tired. A lot of my one day off included me usually I like wash dishes, of course, and like in the house, but then other than that I'll just be like laying around the house for most of it. But then of course when you have like social obligations, it makes it a lot harder. Really choose what's most important for you depending on the week, because it's really hard when you just have off one day a week. But be mindful of it and don't beat yourself up, because trust me, it's impossible to do everything you need to do in just one day off. And if you do everything you need to do in that one day off, you will most probably be tired that next day that you go back to work. So just think about that. The next tip number 9, is preparing for the week ahead. So that still goes into prioritizing what's important to you. However, when you're an intern, you really get into a schedule. You pretty much end up doing the same thing over and over again. Like you're working 6 days a week and you know when your golden weekends are. So you would be able to really in your head figure out like, what you can and can't do. And then that way you'll be able to prioritize what you're going to be able to do throughout the week. Some people talk about like meal prepping. You can meal prep. I was never a meal prep person because I'm the type of person who one day can eat like, for 1 week I can like eat like 4 days straight and not be sick of the meal, and just randomly another week I'd be like, I don't want to eat this meal again, I need another meal. So I'm not a meal prep person, but of course like on your day off or on like an early day that you get off, or a day that you're off and you have energy, you can try to meal prep. It's up to you. Everyone approaches prioritizing their week completely differently, but I would say make sure you put in the things that are important to you, such as if you exercise all the time, make sure you do that. If you want to visit your family like once a week, depending on where you live, make sure you do that. Do things that will keep you sane, because intern year is insane. Have something in your life that makes you feel like you. Tip number 10, and it's addressing step 3. Get it out the way as soon as possible. So when I say as soon as possible, I don't say like July and August, because at that time you're just trying to figure out how to be an intern, really overwhelmed. So I would say try to do like October, November, December. I took mine in December and I felt like it was late. Like I was so overstudying and I wish I had taken it earlier. But that was my personal opinion. A lot of my co-residents did it like later on in the year. But for me, I was happy that I got it done in December, and if I could have done it again, I would have taken it earlier, just because it's just like something annoying hanging over your head, and then you're just so busy in intern year. It's just like, why I have to study for this also. I know some people try to push it off till later, especially the ones who are in internal med, because they say the longer you take to study for the test, the more prepared you will be, because you're on the floors and you'll be learning on the floors as well. That, I guess you can say that, but also when you're studying for the test, it helps you for the floors also. I felt like when I was studying, I was able to apply all the things on the floors, and it helped me as an intern. But also I do agree that when I was on the floors, there were things that helped me study for the test. So it's a give and take, and it's up to you, but I would say just get it out the way. It's just like it's another standardized test. Why have it hanging over your head? The next tip I want to talk to you guys about is knowing your limitations and accepting it. What I mean by that is that there are going to be a lot of people in the hospital who want you to do a lot of things, and you're doing a lot of different jobs. However, you have to know what you have to understand that you don't know everything, and that you need to make sure that you're running things by your senior. For example, if a nurse calls you and says, and this is just a very plain, simple example. If they call you and say like, oh, the potassium is 5.8, can you put in this order of K-exalate stat? Okay, Let's just say that you've never even heard of K-Exilate. You're not even sure if this is the next step. You're wondering if maybe I should be doing something before putting it in that order. Don't just say okay because someone said, I need this right now, please give it to me. Make sure that you run this by your senior. Another example, my own personal experience. I was in the ICU and I didn't really understand ventilator settings. And the respiratory therapist came and said, hi, this is the ABG readings, and these are the settings that the patient is currently on, and I was wondering if I should change the settings to this. I think that we should. And this person didn't say it in an emergency-like manner for me to say I need to make a decision now, but I was just like, oh, I'm not really sure, but this is the respiratory therapist who's an expert at their job, so I'll just go ahead and agree with the respiratory therapist. And I was just like, sure. And I didn't know why I was saying sure. And then my attending came and was like, why did you agree to this order? And I didn't have a response. And at the end of the day, you're a physician, so you need to know why you're doing something, okay? And if you don't know why you're doing something, take it up with your senior or your attending, because that's their role to help you figure out, why am I doing something, and why am I treating a patient this way. Those are my tips. And just so you know, it will take time for intern year to feel like okay for you. And really, it was tiring for me throughout the whole year. And you don't really feel like you have the hang of things until like 4 months in, maybe. Throughout the whole year, you'll have questions. Throughout the whole year, you'll feel like you still don't know a lot of things. So it's a day at a time. Okay, now addressing COVID. So when it comes to COVID, it's just a few little general tips. So I think the most important thing, there is no emergency more important than making sure that you are dressed appropriately when you are seeing a COVID-19 patient. What I mean by that is, like, if you get an emergency call to come see a patient right away and it's COVID-19 positive patient or under investigation, meaning we're still waiting to get the test results, make sure that you dress appropriately, because nothing is more important than your own health. Do not risk your safety. So what does properly dressed mean? So for COVID-19 patient, at least for my hospital, you were wearing the N95, you're wearing a face shield or like little goggles, you're wearing the bonnets or the scrub hat, you're wearing the gowns, and you're wearing gloves to see a COVID-19 patient. When I saw those patients also, I would double glove. That's the only other extra thing that I would do. I usually wore scrub hats or the bonnets, and I would use the ones that were in the hospital, but everyone nowadays are like selling them, or like a lot of people are like making them and bringing them to the hospital. So I have a lot. Like, I had this one was actually the cutest, one of the cutest ones I have, because this one is like a fancier bonnet. And then I had these as well. I actually had a lot. And then I would wear that, and then I would wash them. So that's when you're seeing a COVID-19 patient. When you're seeing a non-COVID patient, you wear the surgical mask and the face shield. The face shield was new for my hospital when I was last there. I don't know how many hospitals are doing that. However, I personally wore an N95 for every single patient. Everyone doesn't do that. I know a lot of attendings did it, but it's up to you if you want to do that. Early on in during the pandemic, we had a lot of patients coming in that were negative that then became positive, and I don't like that. So I'd rather be safe than sorry and just wear an N95 for everyone. I mean, you're wearing the N95 anyway throughout the day. Why not just eat for all the patients? But that's up to you. Like I said, I know a lot of people who did it. I have a lot of co-residents that didn't do that. The next tip I have for you is family communication is very important for COVID-19 patients. The reason I'm saying that is because, yeah, we do update families all the time, but specifically for COVID-19 patients, they aren't allowed to have family members in the hospital or loved ones in the hospital. So for both the patient and the family member, it's very anxiety provoking. It's very scary. It's very unnerving when you have a loved one in the hospital and you don't know what's going on. So it's very important as the patient's provider to actually be reaching out to the family and letting them know what's going on, and letting your patient know as well that, I'm updating your family, and they are aware of what's going on, just to help build rapport between the family and the patient. Working with COVID-19 positive patients can be very challenging. It can be emotionally, mentally, and physically draining. Some of these patients will come into the hospital and spend 1 to 2 days, maybe sometimes 1 to 2 weeks, but they'll be able to go home. Others may come into the hospital, they'll probably spend time in the PCU, can spend time in the ICU. A lot of the day-to-day changes can be very challenging. A lot of the times you'll have to be speaking with family, giving family updates multiple times a day, making difficult decisions with family and the patients. And sometimes these patients won't make it out of the hospital. Make sure that you're paying attention to your mental health. Things you can do is to share your emotions and your feelings with family, loved one, even with your co-residents. If you think that your mental health is greatly being affected, a lot of hospitals have resources for physicians. Make sure you reach out to those resources as well. When I first started working with COVID-19 patient, every itch in my throat, every scratch, every feeling of unwellness, I always felt like, oh no, is this COVID coming to get me? Because I knew I was exposed. As I worked with patients and didn't get sick, I started feeling more comfortable. And it's not to like make you get your guard down or anything, but just to let you know that it's okay if you start feeling if you feel a little bit anxious and sometimes you're feeling a little bit scared. I got tested when I felt unwell while working with patients, and the hospitals actually want you to get tested if you feel unwell at all, because you want to make sure you're protecting yourself and your patients. So if you're feeling unwell, don't feel ashamed to say, I want to get tested. Also know that it's okay if you have a little bit of anxiety about it too, because we all did when we first started working with the COVID-19 patients, and you do get more comfortable as you continue to work with them. So that's a wrap. I hope this was really helpful. I have a lot more videos coming out. These videos are for anyone who's interested in training in medicine or currently training in medicine. If you have any questions or any comments or any feedback, please make sure you leave a comment. Follow my Instagram at The Real Skin I'm In. Look out for my next videos coming out. All right, bye.